And plaque stabilization means exactly what it says. Now, you know, we've all probably heard of a plaque, unfortunately, because these diseases, heart disease, by the way, heart disease, the #1 killer of men and women, the #1 killer of men and women, most cases completely preventable through proper dietary approach. By eating more saturated fat and cholesterol-containing foods, you can lower this thing that kills, it's a #1 killer of men and women, all right? Moms, dads, aunts, uncles, you know, friends, you know, spouses, husbands, wives. This is something that is virtually, you can eradicate this, okay? You know, but plaque stabilization, let me get back to that. That's when, you know, you have a plaque in a coronary artery or carotid artery. Let's focus on the coronary arteries, the arteries that supply the heart itself with blood. So here's a coronary artery with plaque in it. Now, it's when parts of that plaque rupture, and the body's attempt to heal that plaque rupturing, that causes your heart attack or stroke. So it makes sense that if you plaque stabilize, you make the plaque less likely to rupture, all right, you'll prevent a lot of heart attacks and strokes. So for my patients, some of my patients, not all, I do use statins in select cases to plaque stabilize to prevent the plaque from rupturing. But make no mistake about it, that plaque buildup in the first place came from the transformation of sugar molecules. It did not come from the consumption of cholesterol or saturated fat. Back to this equation here. Let me just say something that's very important, that the only thing that I've seen eating more saturated fat and cholesterol-containing foods has done for my patients, it's helped them lose tons of weight. It helps them lower their triglycerides. It helps normalize their blood sugars, but it also raises their HDL. The only thing I've seen in clinical practice over the last 18 or so years that significantly raises the HDL, the heart-healthy HDL, the protective cholesterol, is the consumption of more saturated fat and cholesterol-containing foods. Exercise doesn't do it significantly. Omega-3 fatty acids doesn't do it. Coenzyme Q10 doesn't do it. The only thing I've seen significantly raise the HDL by 1.5, 2, sometimes tripling the HDL number has been the consumption of more saturated fat and cholesterol-containing foods in one's diet. And this is not promoted widely by the American medical associations. And I don't mean the AMA by that. I mean just by although the AMA doesn't promote that. But I'm saying, like, you know, all of your organizations out there still adhere to the incorrect dietary belief that, you know, low fat, low cholesterol is the way to go. It's wrong. So lowering total, so we learned, what did we learn? We learned that lowering total cholesterol has never been shown to lower one's risk for heart disease. We learned that the term cholesterol-lowering medication is a misnomer. That you really, lowering total cholesterol is irrelevant. And what happens in some people is that these cholesterol-lowering medications lower the HDL, or the good cholesterol. I'll never forget this particular case. I had a gentleman in the examination room, and this is when I was new to the low-carb regimen. And he was sitting on the examination table, and he asked if he could bring his brother back. And of course, I had no problem with that, as long as the patient was okay with that. So then I'm talking about this whole concept here, the correct way to eat and whatnot. So his brother chimes in, and he says, what would you do with a patient? Now, when I look at lipid panels, just so my viewers know, my eyes don't go to total cholesterol, my eyes don't go to the LDL. I didn't even get to the fact that the LDL is calculated. I'll see if I can get that in the remaining few minutes. I look at the total cholesterol, I'm sorry, strike that. I look at the HDL, I do not look at the total cholesterol. Let me correct myself. I do not look at the total cholesterol. I look at the HDL and I look at the triglycerides. And if the HDL is above 59 or greater, I'm good with that. If the triglycerides are no more than 2 times the HDL, with an HDL 59 or greater, which generally means your triglycerides are going to run around 120, then I'm good with that. I ignore the total, I ignore the LDL. This was important information because, for you to know, or to hear, because the patient's brother then asked me the question, what would you do with a patient whose total cholesterol is 305, whose HDL was 90? And I said, stop right there, nothing. This person is not in danger of having a heart attack. I would not put this person on a medication. And if you did put a person with those numbers on a medication, you could lower their HDL and you can actually put them at risk for having a heart attack. This gentleman looked me in the eye and he said, that was me. The doctor looked, he saw that the total cholesterol was about 300. He panicked, he put me on whatever medication it was, which doesn't matter. Lowered the cholesterol, it was a statin, lowered the cholesterol, but it also lowered the HDL, and this person went on to suffer a heart attack. It's a shame. It's a shame. And, you know, let me just, you know, end, you know, this session. And again, I'm just very excited to have a live webcast. And I thank Dr. Bones, who really didn't ask me any questions. Maybe he can ask me some questions next time. You okay there? Yeah, he seems pretty, He's for Halloween, by the way. Just let me say this. Happy Halloween, everybody. Thank you so much for listening to me. I know for many of you this is very controversial. This is very unconventional. This is very revolutionary. But please remember, please embrace this. These are facts. I'm telling you the facts. Don't ever forget that. And as I leave you today, always remember that sugar is sugar is sugar. Bye for now. Thanks so much.
Until next time, be enlightened, be encouraged.